1, 2, 3, a little pinch. Pass them here with me here. Okay, open just for a sec because I need to see. So we're going into the hollow that she didn't like in her eyelid right here. I'm just doing baby pulses. Feeling okay?
Mm-hmm.
Good. Almost done. Open. Good. Still. Close. Okay. A little bit more. I just don't like to overdo this because it doesn't look good if you do.
Mm-hmm.
A teeny bit more. Almost done. Okay, perfect. So just doing a hold with your right hand, a little pressure there. Perfect. Just hold that a second. That's good. I'm going to do the other side now. You can